So let me say a warm welcome and hello to everyone. Good morning, good afternoon, good evening, wherever you are. Welcome to this webinar session on the Global Disability Inclusion Report. For those who don't know me, my name is Dominic. I'm working with CBM and I will guide us through this webinar today. There is closed captioning organized for this session. You should be able to find the link in the chat window. Angelique has posted it there. So international sign captioning will be available to all of us. Okay, and with that, let me briefly share a short framing for the webinar. Our plan was that after the launch of the Global Disability Inclusion Report, we'd have a session on this important multi-stakeholder report that was prepared for the GDS 2025. The report is the result of a collaborative effort of several UN agencies, the International Disability Alliance, a number of academic institutions, and also some members of IDDC, of course, contributed to this report. So more specifically, today, we thought it would be great to have a session to become a bit more familiar with the content of this important reference document, and also to understand how IDDC members can make use of the report going forward. Therefore, it's my pleasure to welcome today the two lead editors of the report, Alex and Morgan, who are with us today. Welcome. Welcome, Morgan. Welcome, Alex. Wonderful having you with us. And also to welcome Jared from the Global Secretariat of the International Disability Alliance. Welcome, Jared. Great having you with us. Okay, wonderful. So for this 2-hour session, the plan is that we will hear from IDA's perspective about the relevance of the report and also the contribution of IDA and its membership to the process. Then we will have plenty of time to dive into the content of the report, and Morgan and Alex will take us through that. And then we'll share a few thoughts about how civil society can make use of the report and engage with further steps of launching and making the report, promoting the report and making it publicly available. And we'll have plenty of time for questions and exchange. I think one last housekeeping thing is, if possible, we would love to take a picture so that IDDC can also post about this session on LinkedIn. Therefore, I would invite all those of you who are happy to be on the picture to please switch on your camera so that we can see you. All those of you who don't want to be on the picture, no worries. Simply keep your camera off. And Mary, you will take a picture of us, right?
So can I ask a really technical question? How do I get the gallery view? This really shows how really bad I am at Zoom before I... Do I change my view? Anybody know? Who can do that? Angelique.
Top right-hand side, you have a button.
There it is.
View,
there it is. Yeah. Gallery. Okay,
gallery.
got it. Okay. Super, doing it now. Okay, everyone can wave, smile. Yay! Perfect. Okay, all done. Thanks.
Perfect. Thank you so much, Mary and Angelique. And with that, without further ado, I would hand it over to Jared, who can share IDA's perspective on the report as a reference document and also the contribution of IDA and its membership to the process. Over to you, Jared.
Thank you so much, Dominique. And I'm going to try really hard to not use my full 10 minutes, which was generously allocated to me. But if I can't say it shorter, then I'm not doing a good enough job. So thank you for the floor. So for IDA, the Global Disability Inclusion Report, it felt like a long time coming in a way, and not just the preparatory phase, but in a way it was somewhat of a recognition that the 2011 report by WHO and the World Bank was, of course, a landmark report, publishing the prevalence statistic that we all know and love today, still with a slight adjustment from WHO 2 years ago. But that report was in 2011. Many OPDs felt that while it identified general concerns, there was really a lot to say in the period since then, and also that report, it was led by those two organizations and could do more to reflect the totality of the landscape of the disability sector, the voice of persons with disabilities through their representative organizations, NGO, civil society organizations, in particular IDDC and others. So there was a lot to do. I suppose Alex may talk about the joy and pain of production of the report, which in the end was in somewhat of a compressed timeline. But the first point I'm making here is that the methodology of the report was itself very important, and all of the things that everyone here will know and well understand in terms of consultations, accessibility and inclusion and design, and ensuring that the text itself did really respond fully to the realities, priorities and needs of persons with disabilities globally. And there was a very extensive period of OPD consultation. It wasn't easy, of course, to narrow down the themes, but in the end, extremely pleased with how the report came out in terms of what was covered. Can't have everything, of course, but yeah, I think it's a document in our view that should serve us well in the coming years and in a very changing and challenging context. Some quite obvious highlights, but for us, one is that OPDs can and should be drivers of inclusion rather than passive participants, to recognize that despite the advancements in SDG localization and CRPD standards advancement and accountability, still very significant barriers persist in all regions, in almost all countries, regardless of income level. This includes inaccessible systems that have not been transformed to meet the paradigm shift. It includes legal restrictions. It includes really severe underfunding, including of OPDs. Another point was on data, and we very much appreciated the method and the approach to data, which did allow also for what some people call citizen-generated data, including OPD-generated data and IDDC Global Survey, which showed, again, no surprise to anyone, that progress had been made in terms of participation on the basis of CRPD principles, but still this was not only not universal across regions, it was limited to certain kinds of participation and on certain themes. So a lot more to be done. The megatrends section we appreciate very much, and that includes recognition that shrinking civic space will need reflection, will need solidarity, will need unity and innovation, and that includes underrepresented groups. We also very much appreciated the forward-looking nature of the report in terms of upcoming global events, including the World Social Summit, and the challenges needed there to ensure deeper OPD engagement and a culture of collaboration. So yeah, essentially the feedback that we had during the process and also afterwards was that OPDs and persons with disabilities felt heard by the report. They felt that it covered in a very meaningful way their fears, their concerns, their hopes, their expectations of the future. And we do believe and hope that it provides a really robust framework for accelerating CRPD implementation in the coming years. Also building on it, also inspiring OPDs to more than before create their own reports on the barriers they face. We're currently reflecting on exactly how to disseminate the report in terms of a regional and national level capacity sharing, and really looking forward to that process. So for us, it was a very significant value add of the Global Disability Summit and a contribution, a public good from the GDS, and also hoping that this can be a model or a standard approach for future Global Disability Summits as well. So that's just a short snapshot, and really interested to hear reflections and questions as well. Thank you so much.
Thank you so much, Jared, for giving us this snapshot reflections from Ida on the report. And with that, I'll hand it over to the two lead editors, Morgan, Alex. Over to you for diving into the content of the report with us.
Thank you very much, Dominique. Can you confirm that you see the screen?
I can see your screen. It's visible.
Great. Okay, cool. Thank you so much for inviting us and for creating this opportunity. So first, I would like to reinforce an element that Jared was sharing, is the fact that while we had a very short time to work on these reports, it came out from a long consultation process, I think, which was led by Ida. And the report was really designed to respond to demands from OPDs, especially with regards to the element of diversity of persons with disabilities and diversity of context. And we tried across the report to factor those elements. So what can you find in the Global Disability Inclusion Report? First, an introduction, which is more of a reflection on the meaning of inclusion in a diverse and changing world. We touch upon some elements, for instance, related to political economy of inclusion. We may not have delved into this aspect through the report because it's very sensitive and we didn't have the time to really approach it in a way that would have been meaningful and safe. But it's there nevertheless. And I think that when we see everything that has happened end of last year and during 2025 so far, clearly, inclusion is not a neutral word, and there are politics around it that influence the way we do our work. So yeah, I think it was important in the introduction to set that as a framework for the rest of the report. We start with two chapters, chapter 1 and chapter 2, that set a little bit the scene. The first chapter is on diversity of persons with disability and inequalities, and we will hear more about this from Morgan. The second chapter look at the structural efforts that government have carried out to implement the CRPD around legal framework, national coordination mechanism, data, and public expenditure. And then the last three chapters are really looking forward. And the first of those three, the chapter 3, look at the impact of global trends on inclusion of persons with disabilities. We are talking about climate change, technology, care economy, evolution, and so on and so forth. And there was two logic behind that. The first one was those are impacting all society everywhere in a way or another. And it's critical to take them into consideration because they will have impact either directly on persons with disabilities, or they will have impact on some levels of societal change or societal evolution or public policy or resource allocation, which indirectly may also impact persons with disabilities, or via a domino effect will impact resources that are available or the policy space that is available for inclusion of persons with disabilities. Having set these elements and this framework of global trends, chapter 4 look at how can we accelerate inclusion across sector in different contexts, looking at the enablers, the cross-sectoral enablers, but also 4 specific sectors: education, health, employment, and social protection, acknowledging that, yes, inclusion is possible in any context, but not necessarily with the same steps, depending where you are. and the maturity of system in which you operate. And the last chapter kind of look at the overall discussion from a financing perspective, and I will come back to that. And in conclusion, there are a set of recommendations that are detailed by stakeholders, which in the face of it could be seen as fairly generic. And I don't think you will be surprised, or you have been surprised if you read them already. But they have to be read in conjunction with the rest of the report, of course. So many people contributed to the GDIR. It was coordinated by UNICEF with other UN agencies, ILO, ICHR, the UNGDF, UN Women, WHO. GIZ was there. IDA coordinated all the OPD's participation and implementation involvement. IDDC has been critical, and I want to thank you all for the feedback and the contribution in different working groups, in different for different chapters, for different background papers. This has been extremely useful, and we really felt all the knowledge that is also within IDDC membership. I would like to say a big thank you to Dominique and Angelique, who have coordinated IDDC input and did so in a very timely and very organized way, as always. And we had the London School of Hygiene and Tropical Medicine and the Center for Inclusive Policy supporting the drafting of the chapters, especially, of course, Morgan, who is the co-editor. In addition to the report, we have produced already a series of documents. For instance, Inclusion International produced a set of handouts based on a specific process that they started and worked on with self-advocates with intellectual disabilities, taking some of the biggest topic of the report and trying to figure out with self-advocate, what does that mean for them? What needs to change in relation to those different key topics? And we have also background paper. Two have already been published, one on Beijing +30, one on financing acceleration of disability inclusion in low and middle income countries. And another one will be the broader discussion on disability inclusion through an intersectional gender lens, which we are finalizing. The next steps would be the publication of some of the background papers, like on the care economy or on crisis, that have been used for the report. The publication of 15 briefs, which will be basically section of the report, but is published as a standalone in a series, because we figure out that not everybody wants to navigate a 300 pages report. And based on those briefs, we will have a thematic webinar series the last 2 quarters of the year, or let's say fall and winter, that will be led by the London School of Hygiene and Tropical Medicine. And we will have a regional workshop in Africa and Asia that will be led by IDEA. With that, I will give the floor to my colleague Morgan to tell us a little bit more about chapter 1.
Thanks, Alex, and thank you everyone for both being here today and of course, as Alex mentioned, your support and critical input throughout all stages of this report. So to start with chapter 1, the focus here is really on the diversity of persons with disabilities and inequalities and progress towards inclusion. So the emphasis here is to really highlight that people with disabilities are not one homogeneous group. They have different lived experiences, and progress towards inclusion has been unequal. And as such, one-size-fits-all approaches will not be successful. So that is the key message of this chapter. We go into some detail about how different factors affect inclusion. So for example, context is critical. Different countries or areas within countries have different laws and policies, resources, and political will for inclusion, as well as prevailing social attitudes towards disability. Different strategies are needed depending on people's impairment types and the level of support required. There are differences between men and women with disabilities and by socioeconomic status and many other factors that we unfortunately can't cover them all, but we highlight many of the key ones. This section also looks at across the life course, what is the current state of inclusion and what are the gaps? Again, looking at some of these different factors. So we pulled a lot of existing literature for this. We also did some novel data analysis. So as mentioned here, there's over 300 references for this, this chapter. Next slide. So to give you an example, I can't go into all the data that's included in this chapter, but just to give you a flavor of what is in there. For example, to highlight some of the differences amongst people with disabilities depending on different factors, we talk, for example, about gaps in life expectancy. So overall, people with disabilities have live 14 years less than people without disabilities, but there's huge variation by context. So that's 10 years less in high-income countries, all the way to 23 years less. So really highlighting that diversity. That's not the same for all indicators. So multidimensional poverty, for example, actually increases as countries develop. We talk a little bit about why that might be. We also look at differences across the life course. So for example, here are some statistics looking at children with disabilities being more likely to be stunted and wasted in many countries, and differences in unmet needs for care and support amongst older adults, and how that varies by factors such as gender, age, poverty, and level of supports required. Next slide, and over to you, Alex.
Yeah, thank you. Thank you very much. So after looking at the differential in inequalities among persons with disabilities and between persons with disabilities and persons without disabilities, we looked at what have been the structural efforts that have been made by government to implement the CRPD in the last decade. And we looked at legal harmonization, national coordination and monitoring mechanism, data, and public spending. With regards to legal harmonization, I think it's a positive story to a certain degree, as we see that many countries have basically adopted new legislation or revised their legislation following the CRPD ratification. We did, for this report, the Center for Inclusive Policy did a specific analysis looking into the disability legislation of more than 50 countries, trying to understand what were their main characteristics. And what we found is that there are some repetitive or common issues. The first one would be, for instance, the definition of disability that is sometimes confused with eligibility criteria for disability-related support. Then the fact that in many countries it's still rooted in medical diagnosis, for instance. Another issue is the definition of discrimination based on disability, where in many legislation is still vague, and specifically, for instance, does not include denial of reasonable accommodation. Another element is the fact that in many countries there is a bit of a pick and choose with regards to the rights that are in the legislation vis-a-vis the CRPD. For instance, employment, health, and accessibility being very common, while unsurprisingly, legal capacity, for instance, is less covered. And lastly, there is also an issue with regards to enforcement mechanisms. You have legislation that are broader in scope. For instance, some countries have literally translated the CRPD into a national legislation, covering most of the rights in the CRPD, but there is no specific enforcement mechanism or duty bearers specifically identified across ministries for specific rights. There are also elements related to, for instance, the development of mental health legislation, which, while sometimes providing relief and improving some elements around the type of support for people with mental health issues, very often they, however, legalize or formalize deprivation of legal capacity and forced treatment. Then the University of Galloway did a study on national coordination and monitoring mechanism. They looked at many countries, did some key informant interview, looking at those mechanisms. And the feedback is a little bit similar to the one on legal harmonization, namely that there has been a lot of progress in terms of appointing or creating national coordination mechanism, but there is often a lack of convening power, the issue of participation of OPDs, ranging from tokenistic to meaningful, but more on the first than the second. There were also key reflection on the positioning of national coordination mechanisms, whether being close to the Prime Minister or the President's office automatically generate more traction and convening power, and it appeared that it's not necessarily the case. And we will publish, meaning we will make public the paper from the Galloway University, because there is many more information than what we have been able to put in the report. So for those of you that are interested, you will be able to dive into more detail and elements with regards to this section. Then we have a section on data for inclusion. This is not necessarily the section on which we put most of our effort. We made basically a summary of what was out there. And the reason for that is that the Disability and Development Report from DESA did already a very good overview. There is also the Disability and Data Initiative from the Fordham University and the Disability and Data Hub now from the World Bank. So there is so much work that has been done around that. There is the Center for Excellence on Child Disability Data from UNICEF. So we basically give a picture, and here again, we have a positive set of elements, while we see many more countries are collecting data. But one of the big issues we face is, first, in low-income countries, it's not that good. I think with the last round of census, we will see improvement, but still there are elements to improve. And there are big gaps in terms of analysis and use of the data. And the last point being administrative data, where we are a little bit in administrative data where we were a decade ago in terms of statistical data in census and surveys. And finally, we looked at public spending, and this is the first time that a report, an international report, do a comparative budget analysis. We looked at 14 national budgets and countries. For some of those, we did direct data analysis. For others, we built on the work that OPDs have done, CIP has done, but also UNICEF country offices and others like development analytics. And maybe some of you have already seen that in previous webinars, but basically the story that we saw from this analysis is that across low and middle income countries, we have a significant number of countries who have really initial level of investment on disability inclusion and disability specific expenditure, remaining below 0.1% of GDP. And that very often means fragmented type of intervention at low scale and not necessarily targeting inclusion. Then we have another group of countries around 0.1% of GDP or a little bit more. And those countries start to have a basic package of support with a decent or somewhat decent coverage, but still significant gap in scope and coverage in terms of scale. And at 0.5% of GDP, few countries there with more comprehensive program and with social protection at scale. And this is also one of the key findings of the report, is that social protection is the biggest driver of increase of disability-related expenditure, which is not unsurprising. It's also common in high-income countries. But to compare, for instance, OECD countries spend in average 1.5% of GDP on disability-related social protection expenditure, mostly for adults. So it's at least. One thing that we explain is also the fact that those numbers, we are quite confident that they represent the vast majority of the disability-related expenditure in those countries, but we cannot say that they are all the disability-related expenditure, because they are expenditure that are, for instance, related to mainstream services, which are impossible to identify. Even national governments are not able to disaggregate those data. But from the look into the regulation, into the type of programs, we are quite confident that those numbers reflect the majority of expenditure in those countries. We obviously looked also at ODA. I won't go into the detail because I know you are all very familiar with this, but basically we looked at the disability marker from OECD DAC, and we saw that basically 65% of ODA recorded in the OECD DAC is not marked by disability marker, which means we don't know to which extent those are disability sensitive, inclusive. Then if we look only at the ODA from DAC marker, and this is the type of data that you will find, for instance, in OECD data publication or the DESA Disability and Development Report, we see that less than 1% is only or mainly for disability inclusion. 24% include both the significant and principal, which means disability is one of the objectives of the program or as one component in the program. And 87% is the score 0, which means it has been scored but is not disability inclusive, 1 or 2. And now we go to chapter 3.
Thanks, Alex. So chapter 3, the focus here turns to the impact of global trends on inclusion of persons with disabilities. So there's 6 global trends that the report focuses on, which were selected as part of that earlier consultation in drafting the structure of the report. So the global trends are technological change, including the rise of AI and increasing digitization and automation, urbanization, migration and displacement, climate change, humanitarian crises and emergencies, and an evolving care and support economy. So we talk about each of these trends individually, but we also acknowledge that they have lots of overlap between them. So, for example, we know that climate change and humanitarian crises are a big driver of migration and displacement, whereas technological change and the changing structure of families and communities from, say, urbanization or migration affects the care and support economy. So just to really emphasize that we know that these are interconnected, and hopefully we have both provided an overview of each one of them, but also demonstrate how they are interlinked. And again, we had a lot of research going into this section, so over 600 references that can also be used as resources alongside the report itself. And as Alex mentioned earlier, the plan is to have briefs, so separating out each of these sections from the main report for easier access to individual topics, and having webinars where we can do a much deeper dive into each one of these global trends. Next slide. So for each of the global trends, we follow a similar structure. So we start first by exploring what are the current or future impacts of this trend on people with disabilities. And for all of them, we see that people with disabilities are at risk or currently being disproportionately negatively impacted by many of these global trends, particularly when responses are not inclusive. So just to give you some of the statistics that came out for this section, and again in the webinars and the briefs, and there's much more of this, but just to give an idea. So for example, for technology, we see that there is a strong digital divide. People with disabilities less likely to have access to required technology, including mobile phones and internet. And there are significant differences amongst people with disabilities in terms of this access. Children with disabilities more likely to experience cyberbullying, for example. If we turn to humanitarian crises and emergencies, we see, for example, that people with disabilities were 3 times more likely to die during the COVID-19 pandemic. And for many other types of humanitarian crises and disasters, they have higher mortality. With the rise of urbanization, the way that cities are planned is not conducive to inclusion. So one example is, for example, the way pedestrian areas are organized means that pedestrians with disabilities are in many countries 5 times more likely to be injured and die from road traffic accidents. If we turn to migration and displacement, one area of exclusion is in the migration and naturalization laws of many countries, where disability is one of the most common forms of either explicit discrimination or less obvious but still common discrimination. We also see many negative impacts of climate change that are disproportionately affecting people with disability, from their health to their livelihoods to their social inclusion. So one example was for every 1 degree Celsius increase in surface temperature, mental health related mortality, such as suicides or overdoses, increases by 2.2%. And then the way that the care and support economy is changing without intervention increases the risks that people with disabilities will be institutionalized due to growing needs for care and support, but lack of a suitable human rights focused supply. Next slide. We also discuss for each of these global trends key strategies to make them more inclusive. So how people with disabilities can be involved in shaping the different responses and what elements need to be adjusted. So this is to minimize some of the negative impacts that are discussed earlier for each section, as well as maximize potential opportunities, which I'll get to in a little bit. And here we also provide lots of examples for how this has been done in different contexts. And here, getting these examples, it was critical to have input from IDDC members as well as IDA members on different strategies that their members have used in practice. So these examples were really critical to highlighting not just the problems, but also solutions. Next slide. We also want to emphasize that in making these actions more inclusive, there are many potential benefits. So it's not on it. Also, it minimizes the harms, but it also has many areas where you can see clear benefits into spurring progress towards inclusion. So just as some examples, we know that jobs are growing in the green and digital economy. And if training for these jobs, as well as the jobs themselves, can be made accessible and inclusive, this increases opportunities for employment for persons with disabilities, and also means that these fields can benefit from the expertise of persons with disabilities. Additionally, many services and infrastructure and systems are either being built or rebuilt in response to, say, destruction after a humanitarian crisis, as part of urban planning for urbanization, or to make infrastructure more climate resilient. So within all of these new development programs, embedding accessibility inclusion throughout is an opportunity to add on to these existing initiatives. We also see, for example, that technological solutions can improve autonomy and participation of people with disabilities. And so exploring some of these solutions and ensuring equitable access can be an area for growth in the future. And also creating care and support systems that are both disability inclusive and gender responsive, allow persons with disabilities to participate in society and live with dignity, while also reducing unpaid work that is driving gender inequalities. So here, across all these 6 global trends, we do want to emphasize as well the key benefits from inclusive action beyond simply reducing harms. Next slide. I think, is this you, Alex?
Yep, thank you, Morgan. So looking at, once we as I said, when we set the scene with all those global trends, we see also that there are common issues coming back through all those global trends if we want to foster inclusion, which are accessibility, combating stigma, affordable assistive technology, participation, enhancement of persons with disabilities, and of course, care and support systems. And those elements are also enablers of inclusion across sector. I am a child, I need to get to school. All those elements are needed before you even change anything into the education system. The same goes for social protection, the same goes for education and employment. But simultaneously, change in those systems will make those enablers more effective. So it's not we had this conversation among ourselves whether we call them precondition. And there is a strength in calling them precondition, because very often because they fall between ministries, they tend to be a bit orphans and nobody's really investing in them. But we acknowledge for the report that we wanted to highlight also the mutually reinforcing nature of inclusion in sectors and those cross-sectoral elements. We didn't have the space in this report to go really in depth in each of the enablers, acknowledging that, for instance, a lot of work has been done on assistive technology between WHO, UNICEF, Etiscale, and others. On accessibility, especially with regards to IT, a lot of things have been done. On OPD participation, IDA done fantastic work. On care and support, we have increasing publication related to that. And on stigma, there are also some elements. So what we did is basically trying to understand, especially in a context that is a bit resource constraints, what would be some of the key steps to take. And after that, we looked at the specific sectors, and I will give back the floor to Morgan.
Great. Yes. So in addition to the key enablers, we also focus on 4 sectors, being education, health, social protection, and employment. And one of the key asks from the earlier consultations was to have different recommendations that could be implemented in different contexts, depending on where they were at in their level of inclusion. So initially, we were thinking that this would be broken down into low, middle, and high-income countries. But as we got further along in the process, we realized that didn't quite work, especially for middle-income countries where there can be so much variation amongst countries, and some countries with higher resource levels might actually be doing much more on inclusion than countries with much more resources. So due to that, we switched the division to initial, progressing, and maturing. And so for each of these sectors, we had different combination of experts come together to develop what are some recommendations for countries that are at the initial stages, meaning they have not yet done very much to promote inclusion in this area, to progressing, so what can countries build on to advance their initial efforts, and then maturing, so countries that it may not be 100% perfect, but are quite proficient in that area. So there is some overlaps with resource levels of a country. So we recognize that all countries are not going to have the same level of resources for inclusion. And so we do factor that in a bit in the matrix, but we also really want to emphasize here that at all levels of development and resource levels, that countries can be doing something towards inclusion. And there's a ladder that countries can build on to progressively build up their systems. There's some common elements across these different sectors. So there's looking at what's needed in the regulatory framework, what data is needed to inform the development of the sector, the training of key staff, whether that's teachers or healthcare workers, employers, as well as how to ensure the systematic engagement of OPDs across all stages of the system development and implementation, as well as ensuring that there is sufficient resources to be able to undertake these key actions. Over.
Thank you. Thank you very much. Then the last chapter takes all those elements and look at financing. So for those of you that are really interested in the topic of financing, we published last week the background paper that we developed for the global report, which combine elements of chapter 2 and chapter 5, plus more elements that we didn't have the space to basically put in the report, including some short case studies and more examples. So basically, what's the logic of the chapter is trying to understand under the CRPD, what are the obligations of states with regards to financing inclusion, how they must make use of all resources, domestic and international, but they need also to leverage private and community and civil society resources in a way that is equitable and catalytic. They need to make sure that whatever resource they mobilize or leverage should not contribute to new barrier in the environment and should not finance programs or services that undermine inclusion. And in consultation and with meaningful participation of OPDs, they need to put in place mechanisms and budget processes that ensure that across all ministries and level of governments, infrastructure, policies, and programs are inclusive, and that there is more and better disability-specific program and support services that promote inclusion for the diversity of persons with disabilities. One of the elements that we mentioned when we say plan equitably for all persons with disabilities, it is important to acknowledge that when we look at budget, the issue is not only budget for persons with disability and budget for people without disabilities. We know that in many countries, and the analysis show that, historic programs or services are usually geared towards certain groups of persons with disabilities who may have seen the budget for their services kind of stagnating or increasing. And because it's difficult to bring new things in a national budget, those are year after year the programs that get financed. But you will find, for instance, activities like sign language interpretation. There is no budget line for such services in some countries. And because there is no budget line from one year to another, this void continues. So what we are advocating for is in the planning of disability-related expenditure for inclusion, it's important not only to look at what is currently spent and how do we increase that, but actually who and what is not benefiting from public expenditure and what can be done about this. Another thing we did is trying to map out the trajectory of different resources, whether they are domestic grants, domestic revenue, borrowing, or grants, and what is the machinery for which they may pass to be directed towards publicly funded programs and services enabling inclusion. One of the things that you will find in the report, and we will publish also a dedicated paper, I think this report is the first one presenting a global overview of disability-specific financing mechanisms like National Disability Fund in low and middle income countries. Why did we decide to put a focus on those mechanisms? Is because there are a certain number of legislation, actually an increasing number of legislation in low and middle income countries that specifically mention the creation of a disability fund or a national disability fund. And we did not find evidence that those funds are actually making a significant contribution in terms of financing at scale of disability inclusion. They can have a catalytic role, they could play a role of financing of cross-sectoral issues, for instance, national sign language interpretation systems, which every ministry needs, but nobody wants to finance alone. But we didn't really find evidence of such mechanisms. There are interesting practices in different countries, but we didn't identify really a system where we would say, yes, that is a net contribution to financing at scale. But there are elements on which we can build, especially, for instance, countries that have quota-based funds for employment and reasonable accommodation. So it's very important to see what are the specific objectives of those funds. But I think it's important for all of you who work in countries where those funds already exist or are in development or are in legislation. Another thing we tried to do was trying to assess the financing gap for inclusion. This was very ambitious. And the reality of methodological complexity and the scarcity of data brought us back to a severe reality check. And we basically have been able to do the costing of expansion of cash transfer for persons with disabilities in 5 countries. And we looked also at expansion of health insurance coverage. What was interesting is that while we acknowledge that those are only a tiny part of all the different topics that needs to be financed and services that needs to be financed, for most of the countries where we did that, for all of them, we are in expenditure that are already 3 times more to 7 times or 10 times more. And that tells us a lot of things. Is that what we are seeing in terms of financing disability inclusion, both within OPDs, governments, donors, and allies, is a severe underestimation of the scale of the financing gap. And one of the reasons for that is the scarcity of data on costs of needed interventions. We really looked heavily, we scrutinized, we tried to find evidence, and we really could not find much. So this is really something, one of the main recommendations around financing is really trying to, one, have a better tracking of disability-related expenditure in government budget and ODA, but also to have much better estimation of cost to support planning and financing of the acceleration of disability inclusion at scale. Another issue that we looked at, for instance, with ODA was through which channel goes the ODA for organization for disability inclusion. And we saw that when the program is as a disability inclusion as a main objective, in most of the countries we looked at, basically it goes through NGO, international NGO, many of them being IDDC members, but not only. An exception was Cambodia, and this big gray bar that you can see here is the access program of DFAT. So it's a very specific financing mechanism. But if we look at the program that are scored 0 or that are not scored for disability, then we see that it's a much more diverse set of channels, including in the yellow, you will see a much bigger part for government. So it's very hard to tell the clear story about that. But I feel that, and we agreed in the conversation with many stakeholders, one of the reasons is that government ministries or Ministry of Finance that are negotiating big programs with donors do not necessarily see disability inclusion as a priority. And when you remember that the less than 0.5% of all ODA was dedicated only to disability inclusion, it's also supply driven through proposal, etc., by international NGOs. So those are elements, again, we need much more work to be able to understand all the complexity of it, but those are some elements that are extremely important if we are to support government developing comprehensive financing strategies for disability inclusion. We looked also into the private sector, innovative financing. Unsurprisingly, we didn't find a lot because it's often anecdotal or it's very targeted. Transport initiative, assistive technology. And I think the lesson from this overview is that innovative financing will not be what finance disability inclusion at scale, but it can be catalytical, and it can have a big impact either on a very specific topic, like assistive technology, including at national level if the country is not too big, but it can have also a lot of impact at the local level by financing some services or co-financing services. So that's also, we looked also at the logic of decentralization and the issue of fiscal decentralization and how important they are. So in conclusion, looking at all that, we came up with a set of recommendations that we discussed with the steering committee members. Some of you were part of this process. And we identify several thematics. The first one is continue the harmonization and laws and policies with the CRPD in close consultation with OPDs. Where we put an emphasis is including in response to global trends. What we see is that harmonization of legislation so far has been very focused on disability-related legislation, and then some sectors, education, social protection, mostly, some element on infrastructure. But as we see, the global impact of technology, migration, climate change, legislation and policies that are related to those topics need to take into consideration needs and rights of persons with disabilities. Strengthening data system and activities to generate and use data and evidence. So here we are looking at different elements around statistics and administrative data for different stakeholders. Mainstreaming accessibility and inclusion across all sectors. And that's the fact, based on the fact that only few ministries are financing disability inclusion, while the others are not basically dedicating funding to make their services inclusive. And there is a lack of mechanism to finance cross-sectoral issues. Another point that we insisted a lot on is beyond statistical visibility with the Washington Group in Census and others, we need countries to really strengthen across sectors their administrative identification of persons with disabilities or person in needs of disability support. So if you don't know who the person in needs of disability support are, where they live and what they need, you will not be able to provide them with the support they need, including in case of emergency. So that's a very important point. Another point, of course, is scale-up financing for disability inclusion. I will not come back to that. I talked enough about it. Ensuring meaningful participation of persons with disabilities in their diversity, and we insist on the logic of diversity, not only gender, not only type of impairment groups or functional difficulties, but also location, indigeneity or other elements. And the last point is really promoting collaboration and coordination within government and between government, OPD, civil society, development agency, and private sector for disability inclusion. Over on our side. I hope we were not too much over time, Dominique.
We were on the dot, actually. So thank you so much for sticking to the time allocation. That's wonderful that you've given us such a good overview of the report. I would acknowledge that it's a lot to take in during the webinar, but it's a very, very easy introduction into the entire report. So thank you so much for taking us through the report. I would say now we have plenty of time to first check in with the audience if there are any questions with regards to the report and its content. So over to the audience, are there any questions with regards to the report and its content? And while you're thinking about questions, let me also highlight that the link to the report, the full report, is on the chat. So if anyone wants to have easy access, hasn't had the report on your computer, on your screens already, you can find it there. So are there any questions on the content of the report from anyone? Simply turn on your camera and we can have them immediately. Maybe while people are thinking about questions, I have one question already to both of you, which is with regards to the background papers and further publications about the report, which are going to be made available. So currently the report is on the website of the Global Disability Summit. Will that also be the space where further papers will be published and available?
So thank you very much, Dom. We are actually discussing with our colleagues to see if we can have a dedicated page, because now we are just under GDS resource GDIR. The idea would be to see if we can upgrade the GDIR to have its own web page, so we can have sub pages for the background papers, for the webinars, for videos, etc., etc. I think one very important point, Dom, and every time we make the presentation, we have the same feeling at the end. It's a mess. Like I am currently reviewing the French translation of the report. I forgot to mention we will have the full report in Spanish and in French, and it's extremely dense. And I think this is really something also where we would like to have your opinion, colleagues. So we will develop those briefs. There is so much in this report. The question is, how can we make this content more user-friendly for all of you, for your partners? So this is also something that we would be keen today to have to start this conversation also. And I know that some of the colleagues will share their views on this, but this is really something that every time we present it, we're like, oh, it's already 45 minutes, and we said very little about everything that there is in the report. Thank you.
Thank you. Thank you, Alex. So yeah, let's hear from everyone. Are there any questions? Are there any comments on the report? Any thoughts about using the report? What would be useful to have the content in a user-friendly way? That was Alex's question. So come on, folks. Hope that you're with me. There's Ross. Wonderful. Thank you for breaking the ice. Ross, over to you.
No problem. I'm Irish, and as Mary probably will attest as well, just can't handle the silence. You have to infiltrate it with some chat. Alex and Morgan, thank you so much for that. I've been, I guess, familiar at a loose way with the report since its launch. I know that some of my colleagues at Sightsavers were feeding in directly, but that was such a fantastic overview. And yeah, as you say, Alex, the density of the report is something that you can sort of see due to the length. But I think that was just a really good way just to hopefully just open up the discussion. So thank you for taking that time. You asked the question there just about sort of, what would be the most useful way, I guess, for those in the disability sector to be engaging with this report. But I guess one of the key question for me, I suppose, and particularly maybe just building on that point, just around national government engagement and obligations around their CRPD obligations for financially, but also just in that yellow bar around where those governments are receiving ODA. Obviously, a key audience is here are those governments. So I'm wondering, are there plans at the moment to communicate with those governments about breaking down this report or elements of this report to those who aren't engaged at all on disability issues, on disability inclusion, and bringing them really into this space and I guess, yeah, engaging with the content of the report. So I guess the question, I suppose, is focused on the communication with those governments, but I suppose there's a broader question I'm asking there, which I suppose would be about, is there an influencing plan, I suppose, that we're thinking about already to engage with those governments and really try and drive change as a result of this amazing piece of work. Thank you. Oh, and apologies, I probably should have introduced myself as well. So I'm Ross McMullen. I'm the Global Campaign Manager from Sightsavers. So yeah, sorry, that was probably the essential bit as well.
Yeah, thank you very much, Ross. Indeed, and I think this is an excellent question. The primary target group for this report was actually the people you mentioned. There were people in government, technocrats that are in charge of disability policy, but do not necessarily, usually they are in Ministry of Social Welfare, you know, or National Council. They don't necessarily have the convening power. And the idea was to provide them with an overview. I think the content is there. I would not say the format is there. And it's definitely something that with the brief, we will make one step further for this. But as we are looking at webinars, I think it will be very important, as you mentioned, Ross, to have a strategy of engagement. And this strategy of engagement will probably take time to develop and will take different channels. And I'm thinking, for instance, of the new initiative of the Global Disability Fund and IDA that has been launched at the Financing for Development under the Sevilla Platform for Action. I think the work we have done for the report will serve as a background for all the work on financing disability inclusion that will come up. So I see also the opportunities to identify different channels, different initiatives that are not necessarily GDIR related, on which we can repackage the content, some of the background documents, etc., elements of the report to be at the service of those initiatives. I think when we think about the webinar, it would be important also to seek, for instance, coordination with UNESCAP or other intergovernmental bodies that are used to, or the Pacific Island Forum Secretariat, for instance, that are used to convene government around disability issues, to see if we could, for instance, have a specific session, maybe with selected topics that are of particular interest for their members, to be able to do that. But this is where also we really see this webinar today as the start of a conversation with all of you, to see in your engagement with governments, with regional bodies, in a sector or in a region, or if you look at the report and you see something interesting, please tell us. And maybe we can do something for you. Maybe we can prepare PowerPoints. We can help, you know, digesting some of the documents, curating some of the resource we've used for the report to facilitate also your work. This is why also we mentioned the number of references, and there is more than 1,200 references for the report. It's a little bit also of a literature review somehow. That doesn't say its name, helping all of you identify a resource that could be useful also for your work. Does that contribute or answer part of your question, Ross?
That's great. Yeah, thank you so much, Alex.
Just to add on that, I think it'll definitely be helpful as we're preparing these webinars to come back to all of you for if you have any suggestions for, say, key speakers who could highlight not just so we have the content from the report, but I think it's so helpful having those practical examples of how IDDC members or governments you work with have addressed some of these issues in the real world.
Mm-hmm. Thank you, Morgan. Yeah, that's duly noted that we can, together with IDA, see how we can support that. Okay, are there other questions or comments on the content of the report or on how we may use the report going forward? Mary.
I suppose the second Irish person can come in while we're waiting for other people to put their hands up. Alex and Morgan, it's great to hear that there's going to be briefs, because I think, I mean, Alex, you said it yourself, the document, similar to the World Report on Disability, is, you know, and equally the World Health Equity Report recently as well, they're really quite dense. So from an advocacy purpose, It's really about how to distill this information into user-friendly kind of ways to be able to, use it in whatever context with government discussions. And I think IDDC members have quite a lot of, partners and also engagement at national level, where I think this is probably critical. I guess it'd be interesting to hear, because I know there's been quite a lot of a rollout of it over the last kind of couple of weeks and months since the GDS. Be interesting to hear what the take-up has been by policymakers so far. So, where the interest has been in it, and if there's any kind of governments taking a leadership role. I mean, outside of the GDIS kind of, partners in really trying to look at how to use this, information for pushing inclusion. Yeah. So just kind of keen to hear what the feedback has been so far.
I don't think we can tell you that, and to be frank and honest, I don't think many governments have seen it, to be honest. One of the big added value of the report is the fact that it's multi-stakeholder. And I think it definitely made the richness of the report. One of the main weaknesses of the report for its dissemination is that it's multi-stakeholder. If this was a UNICEF report or a WHO report or a World Bank report, the channel for communication to the member states would be much more straightforward. One of the, I would say, limitation of the report was very early on. Like we got the contract in June 24 for a report published in April 25. Within that time frame, we knew from the beginning that we will not be able to have the official vetting of the UN agency participating, because that would take 6 months alone. And that is, I think, is a limitation. Imagine the same report with all the logo of all the UN agencies, IDA, IDDC. That would make a difference. That would make a difference. In terms of the buy-in from government. So I feel that this is why my sense is that we kept money in the budget for dissemination to be able to have those kind of conversations. But as I mentioned, I think it's all of us. This multi-stakeholder group need to reflect on how do we get the content of this report? How do we use the content of this report to support government officials? For instance, we will be working with DESA on social protection. It's nothing to do with this report. It's another project, but UNICEF will be working with the GIZ and others and DESA on social protection financing within IMFF. And there is a disability component. Of course, that all the work we've done for this report will make it immediately in that project. I have the baseline, I have the numbers, I have some key example around social protection. Basically, half of the work is already done. So I can focus on how do I put that in the training package, how, et cetera, et cetera. So for me, I would say that the importance is to get enough people within IDA, within IDDC, within UN agencies that are familiar with the content of the report, so that you can use the report. It's Creative Commons. You can take everything in the report and use it. And basically, this would be the channel. We will see when we do the regional workshop. We have to discuss more in depth with IDA and the colleagues how we will engage government for those regional workshops. But as I mentioned, it could be also making a presentation at the next expert working group of the decade of person with disability in Asia Pacific, for instance. So it's also up to us to identify those opportunities, and whether who will be doing the presentation could be related to the ambassador of the report. after the GDS, we did the first training of facilitator on the reports for IDA members. I think we got very positive feedback. We do not have funding to repeat that as such, but I think if we were putting money together or across the 10 webinar series that we are thinking of, I think if you attend all the webinars, you will become a great ambassador of the report because you will have the content and I think this is basically how we will be able to do it. But you know, when I look at the World Report on Disability, which has been absolutely groundbreaking, if you ask people what they remember from it, is the 15%. How many policymakers have read the World Report on Disability of 2011? Very few. And I think that it's really about all of us. The same goes for the DESA report on disability and development. It's more a repository of data, but the question is, how do you make it alive? That's what WHO is doing now with the global report on health equity. They have an entire program to disseminate the content and the logic behind it. So we don't have that kind of means, and we have a much broader scope. But I think it's how we can
No, I
work
mean, that's
together.
fair. Yeah, no, that's fair. And I think it is about working together. So I think you said there in terms of the channels of ways to use the evidence, and it is great. So a practical question then is when one of the smaller kind of brief pieces coming out, because I think that also will give an opportunity for being able to, IDDC members being able to pick that up and use in their own channels to be able to spread the evidence and use them in an advocacy as well, which I think is our main kind of area of work. Yeah.
So that would be end of August, beginning of September. We would like to have them before we start the webinar series, just at the fall. One of the things that we have in mind, and it's also how this will work. We had a side event that cost frame like this, although all this work informed the World Social Summit. So basically, because the World Social Summit covered so many of the topics that are covered in the report. And one thing that with the time available for both Morgan and I and the resource that we have, the brief will not be complete rewriting of the section. It will be basically taking the section and putting them in separate documents. We would be very keen to collaborate with some of you if, for instance, some of you want to say, okay, I want to transform the section on climate change in a 2-pager. Or on migration.
That's good.
This is where the multi-stakeholder combination, you have staff that know how to do that. You may have a project on this. Let's talk and see how we can transform this content in better products. Instead of paying a consultant to do another limit literature review from the start, etc., let's take the report, boil it down, take some of the resource we didn't have the chance to include in the report, and build new things. And then we just say they are part of or connected to the Global Disability Inclusion Report. I don't think whether it's the co-host of the GDS, and I think, Jarrod, you mentioned it very clearly, this is a global public good. So from that, what we extract and what you can do with it, great.
If I may step out of the facilitation role for a moment, just to make one comment as well. So from where I sit, the first piece for all of us, the first piece of work to do is to remember that there is this report. Personally, I have so many questions with people who are interested in disability inclusion and need an easy entry point into a topic or sometimes an overview. And even if it's parts of the report, just pointing them at read this. From where I sit, it's written in a very simple language still. It gives you a great overview on certain topics and the relevance influence of some of the global trends for disability inclusion, that it's a nice piece for people to say, read these 10 pages. It's just 10 pages. It will give you an introduction into climate change and what are some of the relevant pieces in this area for disability inclusion. So for all of us to remember that the report is there, we have a great resource available to us, and we don't have to go looking somewhere else. And it is up to date because it's just been launched. That is, I think, something that can be a first step for many of us. I'm checking. I'll keep on pushing with the group. We don't have to use the entire time, but I'm checking with the group, checking in. Are there further ideas? Are there thoughts about how to use the report, or any questions about some of the content that was presented today? Simply open up your camera, come online, or you can also post things in the chat, and I will check the chat with you. So there is a comment from Ambrose from Light for the World. Ambrose, if you'd like to, please just come online and you can share with us, briefly summarize your comment, if that's possible. Ambrose, if you can hear us, otherwise I can see your comment. At Light for the World, our disability inclusion facilitator model not only aligns with the vision outlined in the report, but also actively implements it. The model is founded on core principles of empowerment, technical competence, peer-led learning, and systems engagement, which reflect the strategic pillars of the Global Disability Inclusion Report. Whether engaged in sectors such as agriculture, education, digital innovation, or humanitarian response, DIFs are instrumental in bridging the inclusion gap by delivering localized rights-based solutions. Their active participation exemplifies the transition from intention to effective implementation. DIFs, that's a long comment. DIFs are young individuals with disabilities who have been trained to facilitate disability inclusion. They leverage their personal experience alongside their technical expertise to advocate for disability inclusion in various organizations and programs, effectively translating ability into action. So here's a link at an example from Light for the World to the report. Are there any comments, Alex or Morgan, you want to make on this?
Actually, I think it fits very well in the conversation we just had, which is, I think would be interesting to see within such a program, is there any elements in the report or associated documents that can basically feed into the DIF program and the curriculum, and could it be a reading for some of the disability inclusion facilitators, at least some of the section on it. One of the things maybe that I would like to highlight is when we started the process of the reports, and Dominique, I know you remember that, we were quite clear that we will not be coming with a killing number, like killer fact, like the 15%. That we are at a time, and I think this is what really we saw. We are at a time where most is known. The question is, how do you put that together in policies that reach scale? And I think this is, for me, the biggest issue, or the message of the report: scale. How do we move beyond fragmentation? How do we move beyond pilots, beyond interesting initiatives, beyond to really reach scale? And this is why we put so much emphasis on financing. Because at the end of the day, money alone doesn't make inclusion, but without money, you don't reach scale for inclusion. And I think that this is, I would be keen to have further conversation, maybe once people have engaged more with the report, to see how they see this articulation between the work they do, the programs they lead, and how does that reflect with both global trends, the system change, and the financing. And I think this is, we wanted somehow to build a kind of overall connection between those. I still feel, because of the limitation of time, we are in the middle of the work. And part of for me, the dissemination and all those conversations should help us to make those connections between those different chapters. Over.
Thank you, Alex. And Ambrose says, yes, thank you, Alex, in the chat. Maybe on the financing inclusion piece, I think there is a point here. So there is no big killing figure, like you said in the report. But what is new in the report is indeed that this report did not shy away from looking into the topic of financing for inclusion. And we had discussions in the steering group that how complex is this? Are people able to absorb the information? And it's a first attempt to actually making the topic of financing inclusion digestible and approachable for all of us to engage more with it, because it's important to go beyond we need more money, which is the simple advocacy message that has been out there for some time. So is there in this area, is there from your perspective, and Jared, I would also invite you to come in here from IDA's perspective, is there something we should be aware of with regards to what we have now in terms of the financing for inclusion chapter? Are there some entry points? Personally, I really like the overview which you've shown about how systems at country level can engage with the topic of financing for inclusion. That was really food for thought for me at a personal level, but is there anything from your perspective that could be useful for IDDC members in this area?
Yeah, thank you. One element I didn't mention is the 15 for the 15. I know that there are diverse opinions. I just had a meeting this morning with Kenya. And it's the Ministry of Social Protection who leads disability work on the monitoring of the declaration. And it's really fascinating. We were talking about how to engage with the Ministry of Finance Management Information Systems for both budget tagging of domestic and international resources. Those are the type of conversation I have dreamt of for the last decade. And I feel that in some of the countries that have endorsed the declaration, I think if you read the chapter on financing or the background paper on financing, and it will give you elements in addition of whatever you are already doing to maybe have a broader conversation. And I think that for me, the connection of the GDIR with the GDS declaration is really about financing at scale, moving forward the needle. Some of the key elements supporting OPDs to engage in national budget analysis and national budget advocacy is absolutely critical. Another point, which some of you have already worked on, is costing. But maybe not costing of one project, but trying to really work with your counterpart in ministries to see, okay, what would it take to achieve a specific inclusion goal? Even if it's just reasonable accommodation in one ministry, or to get a sense, because then people say, OPDs will say, we need more. And the question is how much more? 10%, 20%, 100%? All the calculation we made, it's like at least tenfold increase. We had the work that UNICEF has done with the Ministry of Social Affairs in Mauritania on the National Disability Strategy with all the sectoral counterpart. They ended up with a costed action plan which anticipate a tenfold increase of their annual budget on disability over 6 years, complemented by ODA, hence their endorsement of the declaration. I mean, those are conversations that are new to a certain degree in low and middle income countries. Another point would be procurement. How do we ensure, and that could be local level, renewal of a transportation mass rapid transit system. How do you ensure that infrastructure and transport vehicles are accessible for people with disabilities? You know, there are many entry points when we talk about scale and budgets, and you will find many of those entry points in the report. Another thing is, for instance, financing local authorities, fiscal decentralization, with big questions that we didn't take side, but for instance, should the perequation formula that is used by government at central level to transfer funds to local authorities, should they take into consideration the prevalence of people with disabilities in the county, for instance? With all the question we have about data, etc., should that be a way of making fiscal transfer to local authorities more inclusive, for instance? Or is it better to put an earmarking like in Ghana? So we share some of those examples in the report and the background paper, and we will have a specific webinar around all those questions, but really looking forward to have your reflection also on, from the work you do with minister counterpart, with local authorities in CBID and other programs, and with OPDs, what would be the angle? What help do you need? What information we didn't cover you would be interested in? And that could help also moving the needle over.
Mm-hmm. Okay, and I'm just looking at the comments from Ambrose. I concur that it is essential to reevaluate our approach to implementing the recommendations. We have received analogous suggestions from various forums in the past, yet they have seen limited or no implementation. Yeah, a very, very valid comment. Thank you, Ambrose. Jared, can I turn to you for a moment, maybe checking in with you towards the later side of our conversation, whether you have also some ideas about how to engage with the report, make use of the report from IDA's perspective. Over to you, Jared, if you can hear me. Jared, hello, hello. Yeah, just checking. Alex, you can hear me, right? Just trying to make sure. Okay, perfect. Yeah, good. Okay, well, let's see. If Jared, when you're back, I'll bring you back on the screen. Otherwise, I would say what I've heard from the conversation so far is, of course, that the report can help us to inform advocacy work. It can also help us to inform engagement at a policy level, more in depth when we have conversations with different authorities in different parts of government, bureaucracy, and administration. I would also say it can help us to inform program work and trying to make sure that program work is relevant, which is also a big part of IDDC members' work. And it may also help us to mainstream disability inclusion into the work of other organizations and mainstream stakeholders by sharing where some entry points and where the relevance of disability inclusion with some of the global trends and topics is. Yeah, so turning the logic around and saying, okay, here we have a global trend, and you can't address it without addressing disability inclusion in this trend, because so many persons with disabilities are affected by a global trend. So these are some elements I take from the conversation. Let me do one last attempt to reach out to you, Jared. Jared, can you hear us? And if that's not the case, I would say I'll take one last round of questions or comments. Is there any from anyone? Oh, yeah, please, Nadia. Over to you.
Hi, everybody. Hi, Alex and Morgan. I was one of those who have been trained 4.5 days, and yet I'm here again, feeling like I was the idiot during that training. But despite this, I was just asked by my organization to write an article on the training, and I couldn't. Since April until now, I couldn't. Every time I try, I was telling myself, what the hell I'm doing? I'm trying to resume the report. No, that's not the proposed. Trying to take what doesn't they know? And I found on 3 things: the procurement, nobody was really working on it when I was asking around. Also the scaling up. The fact, Alex, you don't want to repeat it, but people don't know much about it. And also toward the whole financing part. But as many of our members have no specialists to work on this, I wanted to set up some groups, working groups, during the summer when we are supposed not to have too much to do, But then again, we are overloading ourselves to work on different chapters. And I get from 3 different organizations the question about what is they love to do litigation. And they really wanted to know what can we extract directly, Nadia, to use for litigation, because this will encourage our governments to have a look at this. That was one thing. A second thing was also about who does support this? Would it be possible to have the CRPD committee or somebody else really, how does we say, subscribe to all the recommendation of the report? So they are all afraid to get engaged in such a big work, because it's a big work if you really want to do it concretely, and if you want to put it in line with the priorities of our own small organizations. You know, we will focus on my side on everything, all the pillars of independent living and DI. So they also wanted to know, you know, not to duplicate any work, that if it's really supported by somebody with prestige, then it's much more stronger. The fact we don't underestimate all the work you have done in your organizations, huh? But it's just for the outside world. That those who are going, for example, to review reports in the future, that they may say, yeah, it should be in line with, even if it's inclusive financing. Because after all, financing is a very big part. And then they also asked me, oh, is it possible to set up a kind of blueprint? I told them, hold on, guys, that's for a next step. So these are my returns. And I don't know if you have any feedback or remarks on it also.
Thank you very much, Nadia. Actually, one of the elements you mentioned, we should make a presentation to the CRPD committee. I actually don't know why we didn't do it. It's an excellent suggestion. So I will take step forward. I will talk with our colleague with Facundo in Geneva to see if we can organize a session maybe in the next CRPD committee session. Because I feel that for them, there is a lot of things that could be interesting, especially around global trends financing. They make a lot of recommendations around financing, but they don't have substance behind, and they don't have benchmark. So, and that leads me to the second element. I don't know exactly how you could use the report for litigation. That's a very specific. But what I can say is, especially for low and middle income countries, unfortunately, I would say, because that's where we put most of the focus of the report. But I would say it could be very useful for parallel report to the CRPD, just to set benchmark. Let's talk about financing. That's the topic on which I work the most, and Morgan, don't hesitate to come in for others. But I look at Article 25 on health. I go to the chapter on steps, on sectors, and I look at health, and I look at all the steps that are suggested. And I look at, because you look at the CRPD recommendation, they are not organized like this. You can go into the work, the great work that IDA has been doing on compilation by articles. It doesn't give you the step-by-step structure. You will have the global reports, of course, and the recommendation from WHO, but they are not distributed by level of maturity of system. So let's imagine I am in Togo, or in Sierra Leone, or I am in Thailand. Health systems are very different. I go into the report and I will say, okay, in Togo or in Sierra Leone, let's say Sierra Leone, my health system is still emerging, structuring in many ways. It's resource constrained. What are the suggestions? I am in Thailand. I have one of the most advanced health system in middle income countries. What would be the steps that I can take? The same related to financing. If you look at the distribution I showed, where is my country? Is it in the first group, the second group, or the third group? I am a minus, below 0.1. I am around 0.1% of GDP, or I am part of the 0.5. if I am part of the 0.5, margin of progression will be like, it's possible, but you will not increase by a lot. But if you are at 0.01, you have a massive ground for expansion. And that's, I feel that this is what we have tried to do, is also providing point of comparison for OPDs, for government. So if you ask governments in any country, how much do you spend on disability? Most of them do not know. And they will not know what the neighbors is spending. So it's only 14 countries, but we really try to have fairly representative sample of countries, type of countries, to give an idea. So I would say this is where I see one of the big value of the report. But to be able to do that, you need to know that the report exists and you need to know what's in it. So this is where I come back. And what you have been doing, basically, you are playing the role of an ambassador. You are sharing some of the elements. And in exchange, I think what you get are some, maybe colleagues that want also some shortcuts, which we may not be able to provide. And like, I doubt that we will see the CRPD committee endorsing the report. And the reason for that is, imagine the amount of time that it will require for all the members to endorse a 300 pages report that cut across so many topics, so many. And this was the challenge that we took when we got this report. It was trying to cover all those topics. But I thank you so much. I think that this recommendation or this question about the CRPD committee, maybe we should have a bit of thinking on how we connect with them and how we can help them use the report or refer to the report within their recommendation or their interaction with government. Thanks a lot, Nadia.
Yeah, just to add, I think it would be really great to hear as the report gets used more and as you all use the report, to understand a bit how some of those discussions go in practice. So when those decisions are being made about different policies or programs, how different governments or programs are in practice thinking how they move up that ladder of progressive actions towards inclusion. So we would be extremely keen to hear from all of you as you have those discussions.
Maybe one last question. How much time are you still working on this? So how much time do we still have to come back to you? 1 month, 3 months, 5 months?
There are two answers in the question. The first, I would say until the end of the year. That would be the main time frame. On some of the issues, for instance, financing, we will keep working in the coming year, but I would say it will probably move away from GDIR itself. One of the things that maybe we could explore as with the steering committee, Dominique and Jarod and all of you, but also with all of you colleagues from IDDC, would be once we have finished the webinar series and we have the brief. Basically, we did everything we said we'll do. It could be interesting to see where we stand. And for instance, if there would be an interest to develop an online training, self-paced, with some of the key elements of the report. That would require additional resources. I'm not pessimist. I think it's not that expensive and we could probably find those resources. But we would do it only if there is significant interest, because it's an investment in time. And maybe not all the topics will generate equal attention. So that could be some of the feedback that you could provide us also by the end of the year, is through your interaction with the report, the webinars, and with discussion with your colleagues, etc. Where is it worth to invest more in terms of dissemination?
Thank you, Alex. And actually, we have a few things on the chat now. So first of all, we have from Mary a practical suggestion, which might be to put the GDIR on the next board meeting or task group meeting at IDDC to take the conversation forward. And Mary, I would even extend that to all our IDDC member organizations. Why not identify a forum or a space within each of our organizations to have a little exchange and chat about the Global Disability Inclusion Report and how to use it? So that's one thing. Then there is a question from Ambrose. Ambrose is saying, well, given that many low and middle income countries allocate as little as 0.1% of GDP to disability specific interventions, often falling well below the level needed for a basic set of inclusive services, what policy and fiscal strategies can governments adopt to progressively mobilize and reallocate resources towards disability inclusion without triggering retrogressive measures? And I think that was a question for you, Alex.
My tricky answer would be read the report because we have a lot of that in it. I would not be able to go into all the elements that we looked at, but there are two logics. The first one is, are you in a country that is severely resource constrained? We have countries that are on the verge of bankruptcy, that are heavily indebted, where the fiscal space, which is the capacity to generate new expenditure, including through loans, is severely restricted. That's one consideration. At the opposite spectrum, you have countries who have money, but don't necessarily spend it on the right thing. Many EU countries still spend money, France is one of them, on residential care institutions instead of taking all this money and putting it on community care and support or inclusive education, for instance. So some countries don't have a problem of not enough money, but more likely about how this money is used. In both cases, there is the issue of budget tagging and understanding what is spent on what and what is missing. And that we don't have. In most countries, we do not have. So it's very hard to give blanket advice. The other thing is understanding a little bit the public financial management system. And I give you only one example because it's one of the things that triggered all my interest into public finance. If you look at, for instance, 10 years ago in South Africa, we had this exchange on budgeting with ministries. And we learned that actually special schools were run by the central level, while mainstream inclusive schools are run by the local government. So if the government at central level wanted to transfer the resources from special schools to inclusive schools, they would not be able to do it in a direct way because the money would move back to the big pot of decentralization. And there is no way they could earmark those funds only for education at the local level. So the way you can finance, for instance, sign language interpretation system. All of us says we need sign language in health, we need sign language in education, in justice, etc. How many of us have worked on sign language interpretation system at scale, cross-sectoral? Very few. What would be the financing model? Not only the total amount needed, but how do you organize the financing of that within the government machinery of financing? And I know it seems very foreign to all of us, but if you think of it, many of the effort we are all doing on specific sectors, the success of inclusion for certain groups will depend on the availability of this kind of mechanisms. And if they are not there, the scale of what we are doing will never happen. So, and I know it's cringy and it's not nice and it's not part of my job description, Alex, and I don't know who in my organization can work on that. And this is why also we wrote this report this way, is that in the 21st century, 20 years after the adoption of the CRPD, there are maybe things we need to change in the way we work in NGOs, in UN agencies, if we still exist in a year. That's another question. But this notion of, I think the easy work has been done. Raising awareness, ratification of the CRPD. Now we are entering in the very hard work, which is the scale. Getting it right and getting it at scale.
Mm-hmm. Thank you. Thank you, Alex. And we have two more questions, and I think we also have time for these two more questions. So let me make one more attempt to see whether Jared is with us. Jared, can you hear me? Are you still with us? Because we have one question for you on the chat. If you can hear us, Jared. Okay. Yeah, not sure Jared can hear us. So we'll take that question up and send it to Jared via email. And then we have one more from Nadia. And it's Nadia says, with a smiley, just a real last question. With your previous experiences, is there any comparison in any area with women or gender reporting? And I assume comparison between the report we have.
Yeah,
and
they do it much better. They do it much better comparatively. I mean, it's not great. What we've read and what we've seen. Why? Because many governments do not disaggregate data. They don't tag disability spending or on, but you have the literature on gender and gender equality across sector on the mega trends is so much bigger than disability. There is no question about that. So like when, I don't know, Morgan, if I asked you, with regards to evidence and data, after all this work on the global report, do you think the glass is half full or half empty when it comes to research and evidence on the topics we covered?
Yeah, I mean, you could definitely see there's a huge upward trajectory in terms of some of the resources that are available, that there's increasing research, increasing data on disability. I know we're entering a bit of uncharted territory with a lot of the cuts from USAID and FCDO, and whether we're still going to have those great resources of data, including data on disability, is unknown. But if we were to reflect back on from where we are now, we're certainly getting a lot more information, and how we use that is the next step.
Dominic, you're muted.
Thank you. It has to happen at least once in every call. Okay, thank you. Thank you very much, Alex and Morgan. I think we're coming to the closure of this call, but before I close, first of all, let me say a big thanks to both of you, as well as to Jared. Thank you for coming in and for sharing with us. We know this is time you are taking out of your busy schedules, and it was really, really helpful for us to get a first-hand insight into the report. Really, really useful. So thank you so much to both of you. Of course, I think we will be following up on the different elements that we have discussed today. There will also be follow-up conversations in the context of IDDC and our members. Before we close the call, let me just have a last check-in with Mary. Is there anything you would like to say before we close the call, Mary?
No, just really thank you to Alex and Morgan, and that we'd be obviously very keen and members be keen to really see how to take this forward. So, I mean, I think, as you said, Alex, the conversation's ongoing. So, and there hasn't been much time for conversation after GDS, so we can start to pick that back up now because things are, well, I won't say they're calmer, but they're a bit slower than earlier on in the year. So, yeah, so look forward to collaborating with you on that.
Perfect. Thank you, everyone. And I wish all of you a good rest of the day. Good evening for those of you where it's already late in the day, and see you all soon. Bye. Bye. Bye for now.
Thank you very much,
everyone.
Dominic. Thank you.
Bye.
Thank you.